Good morning. My name is Mandy Torres. I'm a student at Roberts Wesleyan University in the Family Nurse Practitioner program. This is my presentation on enhancing preoperative workflows and patient engagement. All right, the big idea here. This proposed change in practice, it aims to empower patients and staff with the knowledge and the understanding which is necessary for proper colonoscopy preparation and potentially changing the preoperative process. Here's a little table here. It's broken down into the component and the description. We're looking to implement this in the operating room with a focus on improvement in communication and standard educational tools. And the goal here is to increase satisfaction, reduce cancellations of colonoscopies, prevent missed cancer diagnosis. This next little snippet is actually the name of the proposal, which is called SIP, Self Management, Information Sharing, and Patient Involvement. This is a patient centered approach and it's designed to just bring enhancement and engagement through the care process. It emphasizes personalized education and communication strategies which are tailored to each patient's needs, which supports their active role in managing their health. By creating an collaboration and knowledge sharing, this program aims to improve patient outcomes, satisfaction, and adherence to protocols. Within this proposal, there will be an interdisciplinary team, and that's going to be made up of the RN. And the reason for that is to deliver bowel prep instructions using patient friendly language, using the teach back method, emotional support. The RN's also going to reinforce the instructions during the pre-op calls and basically make sure that the patient understands the process. The next member of the team is the FNP. The FNP acts as the frontline provider in the preoperative consultations, is capable of assessing readiness, adjusting the instructions based on comorbidities, and initiating tailored education. The FMP also bridges medical management and nursing education, especially for patients with those complex needs. Next is the gastroenterologist. The gastroenterologist will oversee the colonoscopy protocols and ensure the accuracy of the clinical content and as far as the educational material goes. Also, the gastroenterologist will make decisions for patients with unique clinical conditions requiring altered preparation. The next is the PCP. The PCP is going to be the first to recommend and refer patients for the colonoscopy, first of all, and then they will reinforce the importance of proper during routine visits. The PCP will also help manage chronic conditions that may impact prep quality. The pharmacist is their role to review the medications, such as like if they're on blood thinners or insulin, and they ensure that the patient is safe to actually use the bowel prep agents that are prescribed to them. Pharmacist is also going to teach the patients on possible side effects of prep and hydration strategies. The last member of the team is a part of the IT department. And the reason why they're on this interdisciplinary team is they will help manage patient outreach systems. In this specific case, we're looking at MyChart updates and text message reminders. And the IT will support the instruction adherence within the system, and they will ensure digital tools are user friendly and effective for diverse populations. Also, IT is going to help build the pre op script along with the checklist that will be implemented during the preoperative stage. This little graphic just is showing the roles of the interdisciplinary team, just shortened a little bit from this slide up here. Collaborational strategies within the design, the decisions are going to be made through a decision shared making model. So all disciplines, the RN, the FMP, the doctor, the pharmacist, and IT, they're going to all contribute to the goals on defining them and the protocols. Decisions are going to be guided by, most importantly, the evidence. We're going to look at patient input and seeing if it's feasible across these workflows. How is different perspectives being incorporated into the planning? We'll look at professional input. So each role contributes based on the clinical expertise and the patient interaction touch points, which makes sense, right? We're not going to be looking at the RN to contribute to the IT portion of it. It's specific to each role. And patient feedback, which will be done through pre-designed surveys or interviews, just so we can understand the barriers and the preference of the patients. The coordination, the tasks are going to be assigned based on, again, the scope of practice and the workflow efficiency. So I gave an example here. RNs, they're going to deliver the education. The IT is going to automate the outreach program. The FMP is going to adjust the prep based on the comorbidities, and so on. We will meet at bi-weekly briefings to review the progress, troubleshoot issues, and share any updates. The evaluation. How will these patient-centered outcomes be measured? We'll start with clinical metrics. We'll look at bowel prep adequacy, procedure completion rates, and the cancellation rates. We will also look at patient feedback and use health literacy assessments to measure the outcomes. The data collection and analysis will happen through patient satisfaction surveys along clinical outcome data to assess the effectiveness of the intervention. And once we get this data, how are we going to be using it? We're going to be incorporating input from both the staff and the patients, and we will adjust protocols based on real-time insight and outcomes. These are some communication strategies, evidence-based, that will help facilitate communication within this interdisciplinary team. We are going to be establishing effective communication through developing a team charter to define the goals and the expectations. And we're also going to clarify roles and responsibilities from the outset, from the beginning. Doing this from the very beginning allows each member of the team to know what their roles are very clearly and move forward with those roles. We are also going to be encouraging active participation. We will be using structured meetings with clear agendas, and we will maintain open communication channels. We will be doing this through shared docs and electronic health record messaging systems through MyChart. And last one is leadership and conflict resolution. We will be implementing rotating leaderships or designing a facilitator, and implementing the rotating leadership will be, when it's that person's or profession's time to shine, right? When we're in the process of education or reinforcing education, that's really going to be like the RN's time to shine, and so on and so forth. The leadership and conflict resolution will help address conflicts through collaborative problem solving and transparent dialogue. Basically, we're going to get together as the team, we're going to talk it out, and we're going to use that collaborative approach in order to do that. right? The FNP's role in all of this. So FNPs, they're essential for guiding communication and promoting teamwork, and they contribute to better results. They strengthen the teamwork, and they support the delivery of high quality care throughout the health system. And during all of this, the reflection portion, as a future MP, I plan to bring a collaborative mindset and clinical expertise into the interprofessional team. I will advocate for the patients. I will advocate for coordinating care. And my plan is to ensure that every aspect of health is addressed with precision and compassion. Specifically, in this role, we're making sure that the patients are being advocated for, and the simple fact that we're saying, hey, look, the way this is, we're doing it right now is not working, and we're potentially missing cancer diagnoses from this. That's a huge avocation on the role of the FNP during this specific project, but just in general. And the more that I learn about this stuff, the more that I see that collaboration is very necessary in order to make this proposal work effectively. That is my presentation, and I hope you guys enjoyed. Thank you.